Hello, and thank you for viewing my presentation about a clinical study attempting to implement change in nursing practice. I'm Peri, an MSN student at Eastern Kentucky University, and I conducted this study under the supervision of senior nursing faculty in August 2014. The study was done to address one large knowledge gap in a crucial area of asthma care for the nearly 25 million Americans with asthma and the telephonic disease management clinicians who care for them but who may lack adequate information to provide effective support. Disease management nurses most often work by telephone and must assess and provide education for patient knowledge deficits without visual contact. While they may be accustomed to doing this with other equipment, such as glucose meters, they may have less training in the importance of inhaler technique in asthma management. Asthma inhalers have been shown to be crucial for control, potentially life-saving in an acute episode, and technique determines whether the patient receives enough medicine to be effective. Unfortunately, studies show that as many as 93% of patients and providers are using them incorrectly. This study was aimed at closing the information and awareness gap for disease management RNs in a way that would motivate them to retain and apply this information in patient coaching. Brief educational interventions, especially multimedia interactive ones, have been shown to be effective in increasing knowledge and changing attitudes, although these do not always translate to sustained changes in practice. Basing design on other studies, you can see the reference list I handed out, I provided experienced disease management nurse volunteers with a 30-minute self-paced educational experience consisting of a PowerPoint, an embedded video demonstrating metered-dose inhaler technique, and 4 asthma clinical scenarios to be discussed with other participants applying the new information. Knowledge of metered-dose inhaler technique and each nurse's current practice and future practice intentions were measured with questionnaires before and after the presentation. It was hoped that the interactive discussion component would facilitate deeper learning and increase motivation to apply it. The results did show an increase of 15% in inhaler technique accuracy and collectively a 28% rise in motivation and intent to apply the information in specific ways. Positive comments were made, and 100% of the nurses rated the experience as having increased awareness and knowledge about inhaler technique. Unfortunately, some difficulties weakened the study, making conclusions difficult. It was intended for all participants to have access to the online full presentation. Due to site limitations, some viewed it as printed slides with speaker's notes and a universal resource locator to the video. Future studies where all such aspects are controlled will yield more information about transferability and which components had the most effect. A 6-month follow-up repeat of the first questionnaire would help clarify whether there have been sustained changes in practice, and more advanced discussion with company stakeholders prior to implementation would help prevent any last-minute communication barriers or practical limitations that alter study procedures. Any questions? Thank you for listening to my presentation.